Hi, today we will discuss something about sleep in children. Now, an infant 6-month-old can sleep through the night for 8 hours without waking up to take a feed. But mothers are usually worried. They come to me saying that, Doctor, my child slept for 8 hours. Should I wake her up? No, there is no need to wake a child up because 6 months old child can go without taking feed for 8 hours. Now, sleep is extremely important for growth of children, and it is a very important aspect of childhood. A newborn child sleeps for around 18 to 20 hours. A child up to 1 year can sleep for 15 to 16 hours. From 1 year to 3 years, a child can sleep in 24 hours for about 14 hours, and from 3 years to 5 years, say about 12 to 13 hours, and in adolescent should sleep for at least around 9 hours. This is a recommendation. Now, if a child is sleeping and you are offering breast milk or milk every time the child gets up, the child will not have a good quality sleep, and neither will you. So it is best that a child after the age of 1 year should not be given any feed throughout the night. And if the child gets up, just get her into a habit of soothing herself or himself to sleep. And that doesn't really mean that every time the child cries that you think that he or she is hungry, and you offer breast milk or bottled formula. So if a child has slept well, there will be optimal growth because the growth hormone secretes the maximum during the sleep, and the memory is there. Memory is installed, and you develop memory of all the events that has been happening throughout the day at night during sleep. So sleep is extremely important for growth of a child. Now, if a child has not slept properly, is not had a good quality sleep uninterrupted, then the child might be cranky throughout the day. He'll be hyperactive, will not perform well in school. So it is very important, and so will the mother. Mother will be cranky throughout the day if the mother doesn't have sleep for weeks and months together because of the child's routine. So it is extremely important that we inculcate good sleeping habits from infancy onwards. So there are a few tips for that. That there should be same time for sleeping and same time for getting up throughout the week. At the weekends there can be a variation of 1 to 2 hours, but preferably continue the same things throughout the week and even the weekends. The same sleep place should be there. Most of the time you try as much as possible that the child sleeps in his or her own room, and the child should follow the same bedtime routine. There'll be nothing exciting before going off to sleep. There should be no TV, no mobiles, nothing which is very exciting and which would excite the child's mind. Nothing at all. And as it is, we know that TV viewing is absolutely no for a child less than 2 years of age. And after 2 years, maybe half an hour of TV viewing or computer is allowed. So this norm has to be followed, because once if a child is watching a TV before sleeping, the child will not have a good quality sleep. So all exciting things should be kept away from the child. Now the same routine should be followed. So maybe the best time to go to bed is around 7:30 to 8 p.m. But in Indian scenario, because parents are working, fathers in their business or in their workplace, they have long hours, they reach home very late. So you can say that sleep time should be between 8 p.m. to 9 p.m. So that means you will feed the child around between 7 to 8. So after feeding the child, giving child the dinner, and obviously so, the child should not have dinner in front of television. The children should develop a habit of not eating food in front of any television or computer or iPad, etc. They should eat dinner on their high chair if they are toddlers, and on their chair in the dining room if they are little grown up. So after a meal, and the children should be encouraged to eat themselves, feed themselves, but obviously they should be observed. Now once the child has had his or her dinner properly, the child should follow the same routine, like child should go towards the bedtime. So the child will brush the teeth, the child will change clothes, he will go to the bathroom, read a book, and then gradually soothe himself to sleep. The child should not be rocked at all to put him off to sleep. The child should not be offered a bottle to put him off to sleep. So if the child follows the same routine, he will self-soothe to sleep. And just in case he gets up at night, it should be a habit that he should self-soothe to go off to sleep again. Now about reading the storybooks, see, storybooks can be really exciting for a few children. So it's best that some old storybook that the child has already read, or you have read it aloud to the child again and again, should be read at the bedtime, so that it becomes a little boring, so the child's mind is not excited. So this way, if you maintain a routine every day, and there should be no nap after 5 p.m. Only 1 hour nap in the morning is necessary. So all together, this child, if he follows the same routine, this child will sleep well throughout the night, and so will you.